You know, some wise person told me that when it comes time to ask for funding, the organizations, the nonprofits, will want a very careful record of what you've done and what's been said and so forth. So I'm trying to do just that. So welcome everyone. I'm Linda Haskins. I'm going to facilitate our meeting. We're going to have a few more introductions because we have some new faces tonight. So I think, Steve, if you could start with that. Sure. Just introduce yourself and what you do.
Sure. My name is Steve McGee. I'm the pastor of the Presbyterian Church in Exeter. I've been here for, well, since 1994, so about 23 years. Mm-hmm. And my wife runs a grief support group called Grief Share. Mm-hmm. And of course, we've seen more people that have come as a result of loved ones dying from opioid situations. Our son died 10 years ago from suicide, so that got us into this unfortunate business, not the opioids, but the grief. Mm-hmm. part. So yes. Anyway, happy to learn more and happy to be here.
Thanks for coming. Karen.
I'm Karen Moyer. I'm with the photographer. And I'm a retired social services administrator. So although I primarily ran programs like the WIC program, childcare programs, literacy programs, those kinds of things, and I didn't see a lot of experiences with opioid epidemic, but we dealt with a lot of other issues. I had social workers that were brought on into the WIC program, which most programs didn't have, because we were trying to save infants. We had lost a few infants before we had social workers. So anyway, I'm very committed to the cause, but interested in learning more about how we can help.
Thanks. We're glad to have you and all your experience and background as well. Okay, Ms. Dupel, you're up.
Okay. Hi, my name is Olivia Dupel, and I work as the Seacoast Prevention Coordinator. The state has 13 public health regions, and I work for the Seacoast Public Health Region, serving 23 of the Seacoast towns. Prior to this, I was working for Granite Pathways with the RAPS program, taking calls from the New Hampshire statewide addiction crisis line for about a year. Helping people access treatment services and find support, helping parents find support groups and things like that. And I am also a person in long-term recovery myself, so I'm really happy to be here and help with anything, any guidance you guys might need, and share some resources as well.
Excellent. Glad to have you. Thank you for coming.
My name is Devin Oot, and I'm the Executive Director at the Partnership for a Drug-Free New Hampshire, which is the state-contracted organization to do messaging for the substance misuse, the solutions and problems of substance misuse. I can kind of get into what our organization does during my agenda time. But I also began as a youth in prevention at Dover Youth to Youth. When I was growing up, that was part of the Dover Police Department. And then I moved to the Seacoast, and I've worked in prevention ever since, over the border in Maine and now in New Hampshire for the last 2 years.
Excellent. Thank you, Devin. Ryan.
My name is Ryan Fowler. Excuse me. I'm a resident of Exeter. I'm a person in recovery, former injection drug user. I currently work for Granite Pathways, taking calls through the statewide addiction crisis line through RAPS, and I'm also working with Safe Harbor Recovery Center in Portsmouth and Seabrook. So
you're a busy guy. Thanks, Ryan. We're glad to have you. You know, it occurs to me that some of the new Pastor Emily, please. Would you just introduce yourself?
Sorry I'm late. I had
no
someone
problem
in the hospital. My name is Emily Heath. I'm the pastor at the Congregational Church. I'm also a person in long-term recovery, and so I'm happy to be here on these efforts as well, and I'm really pleased that we're all talking.
Awesome, thank you. I think we should just ask those who were here before to say who they are and what they do for the people that are new. Jamie, would you?
So my name is Jamie Stahl. I'm the Student Services Administrator at the Exeter High School and the Cooperative Middle School as well.
What does the Student Service Director do?
I oversee the guidance department at both schools as well as our student assistant counselors at both schools.
Excellent, thank you.
Jamie.
James.
I'm James Murray. I'm the health officer for the town of Exeter. I run the health department and in charge of the public health for the town.
Thank you. Chief.
Bill Shoup, Chief of Police, town of Exeter.
Thank you.
Hi, Lillian Buckley, pastor of First Baptist Church in Exeter, wanting to help in any way that we can.
Thank you. Cleo.
Cleo Cassidy. I'm with the Society of St. Vincent de Paul, and we address the social, economic, and health injustices in our community.
Wow, that covers a lot.
You got that right.
Bruce.
Detective Bruce Page. I work for the Exeter Police Department. I'm also the community officer.
Thank you. Janice.
I'm Janice Jewell, licensed social worker. I have a private practice in Hampton, and I lost my son last year to an overdose, so I'm happy to be part of this coalition.
And we're happy to have you. Thank you. So I would just say briefly for the folks who are new, last time being our first meeting, we did introduce ourselves to each other, and I said a few words about my commitment to the issue. I lost my mom to alcoholism and cirrhosis when she was 47 years old. So I really grew up with a mother who was ill all of my childhood. And then my sister lost her boy in 2010 to an overdose. And I saw how devastating it was for my sister. She had a stroke 6 months later and has been in poor health ever since. So the only thing you can do with that pain is to put it to use, right? To figure out, something to do, and it certainly gives you a sense of purpose. So when I moved back to town this summer, having been away for, I think, 15 years, I started asking questions and had been part of a coalition in Ipswich, Mass. And since it didn't appear that we had one as yet, I thought it was a good time to start one. So here we are, and I really appreciate all of you being here. So at this stage, we are gathering information. We are trying to educate ourselves. What is the shape of the issue in our community, if we know? And where do we get the kind of information? If someone were to come to any one of us and say, I have this friend who's in trouble, I think he's using heroin, I don't know what to do, at the very least, we want to have some response to that, because it's a matter of life and death, simply. And there are resources, and we have two experts here tonight who work for organizations that are very committed to the issue, and we're pretty excited to learn from them about what their organizations do. And so I'm going to turn it over to Devin, if you would please tell us about your organization.
Sure. So I have a flashy one-pager, so
Great.
if anything I
We
say
love it.
you forget or want to reflect on, you can. So I normally stand when I talk.
Please,
so
sure.
it's not,
By all means.
Just so I can see everyone. So the Partnership for Drug-Free New Hampshire is described best as a coalition of coalitions. So we work together with members across the state. There's no membership fees or anything like that. Really, everybody in this room can already consider themselves a member of the partnership. It's mostly just people that really care about the topic, want to do something about it, or are doing something about it. We work with the Chief of Police Association. We work with all sectors that a typical community coalition works with, but at the state level. And then we work with all of our regional partners, such as Olivia and the other folks within the regional public health network system. And we make sure that we provide messaging, whether that be graphics on social media, whether that be an op-ed in the paper, or whether that be a full-blown media campaign, such as our most recent campaign, the Speak Up New Hampshire. And another thing to pass around, sorry, I'm giving you the heavy ones. And these are magnets from our most recent campaign, Speak Up. And this came out of a community conversation such as this. There was a couple of folks, we were saying, okay, what is the barrier for us going into action? And everybody in the room, pretty much everybody in the room said stigma. People, it was really before this conversation began before the opioid crisis was really as main street as it is now, and it wasn't on every single paper when we were having this conversation. And they said we need to talk about addiction, and we need to talk about it in a way that is going to reduce those barriers for people to seek help, and for people to feel comfortable talking about addiction within the prevention sphere as well. So we got together, we hired a creative team to come in and hold some really great focus groups, and created commercials on the radio, TV, brochures, magnets, what have you. And we've seen really great results. We just had our campaign evaluated, and it reached 725,000 people, which is a lot in the state of New Hampshire, but that also includes crossover into Massachusetts, Vermont, and Maine, because a lot of the radio stations have like bigger spheres, and our digital got shared by people from all over the country. We had 5 states buy the campaign from us for basically free to run it within their own states. And we're looking to continue this. We also had another campaign called Check the Stats, and that was way before the opioid crisis was a real conversation. And it was, hey parents, underage drinking is a thing. Hey parents, your middle schooler needs to have the conversation about alcohol and drugs now because we're seeing 14-year-olds using. And that was, to date, the largest public awareness campaign in the state of New Hampshire, and received the most in kind of any campaign in the state, and still has, which is saying a lot. Our Speak Up campaign had $500,000 in just in kind from our media partners of playing, which is really great.
Yes.
With that said, we're expanding as an organization. We're now contracted with the state. We receive charitable dollars from the New Hampshire Charitable Foundation that are incredibly flexible. So I personally am very excited because I live right in Hampton on Exeter Road, so this is very close to home. But we try and get in on these local conversations and realize what the messaging really needs to be. And then we'll take something from this meeting and go to Franklin, New Hampshire, or Laconia, and say, do you guys see this same trend? And we do that for saturation, which is just a fancy marketing term, meaning everybody's on the same page. And we create messaging. Right now we're doing a maternal health campaign. So there was a donor who donated $1 million to the Charitable Foundation, and we are receiving a large portion of that to do a campaign within private practice, OBGYN offices, and then general public for supporting moms to not use substances. It's not necessarily for moms who are already using substances. It's a prevention campaign for alcohol and marijuana. And with that, we focus very heavily on prevention in our organization. And opioids, of course, are the forefront of everyone's mind because of how incredibly negative the consequences can be, as extreme as death, obviously. We've all probably have been touched if we're all sitting in this room from the opioid crisis. But we also try and make sure that we are touching on the deadliest drug in our state, which is alcohol, as well as other substances such as marijuana. There was a national report that came out this morning saying that inhalant use for teenagers is the highest it's ever been. In vaping marijuana, 1 out of every 10 high school seniors has vaped marijuana in the last month, which is an incredibly high number, and we have to start looking at vape devices and nicotine delivery systems as something other than nicotine delivery systems, because we're seeing more and more it's not just marijuana that they're using them for, and it makes it really, really difficult for our friends in law enforcement, our friends within the schools, to detect what substances are being used. We did a focus group recently, and a kid told us that it's really easy to use it in school because you can just blow it in a water bottle and no one sees the smoke, or whatever it's called, the cloud.
Juice, yeah.
Yeah.
They like to call it juice.
And they don't smell it. It's really, really easy to hide from parents. We went to a teen treatment group, and we're working on creating content from this because it was really, really impactful on what they were saying on why they used to begin with, or how they had struggles to get into successful recovery. And as much as there is no connection between someone who drinks and uses marijuana to result in opioids, you're going to be really far-fetched and to find someone who's using opioids that didn't start with those substances. And why were they starting with those substances? And we can go back to early childhood and see that they might be unhealthily coping with stress, or might be trying to self-cope for anxiety, etc. So those are some of our priorities right now in terms of messaging, but we are also really focusing on the young adult population. And I know you guys are a really new group, but I'm not sure if you guys, are you just focusing on the community at large?
We have not zeroed in on exactly what we choose to focus, but we're going to do that soon.
That's a bigger conversation too, like who do we want to focus on, how are we going to do it? That's a really big conversation that's important to have, especially in these coalition settings. But we have also seen that the young adult population, we were creating the state plan with some other members of the Governor's Commission on Alcohol and Other Drugs. And we were looking at things that were impacting the young adult population in terms of services. There's not a whole lot. And we're in the Seacoast, which actually has a lot of services. Manchester, Seacoast, a little bit of Keene, Stratford County. Those are areas of the state that actually are pretty plentiful in resources. But even the resource plentiful areas didn't have the resources needed for young adults. So how can we support young adults in messaging, policy change, et cetera, is also one of our big areas. There's probably some, I know there's one that Seacoast have young adult.
Yep.
So there's folks in the Seacoast designated just to be working on that young adult work, and we're kind of leading the charge on that piece. So it'll be great to see them interconnect. I know Exeter is one of those towns that's getting some of like the Portsmouth folks. It's becoming younger. Yes? No? Maybe? Not really?
That's a good question. I've invited Russ Dean, the town manager, to join us. He hasn't been able to as yet.
Yeah.
But we could probably get some input from him, you know,
That'd
in
be
regard
great.
to the composition of the town.
You guys might know just from your work.
Yeah, I know the town working on the master plan. I've sat in on those master plan meetings out at the high school, and I've heard people, you know, that have come out and said that whether they're 20 years old, 30 years old, that they're looking for something here, whether it's entertainment or work. And, you know, some are leaving, some aren't. But I think what you're seeing with the new economic developer and some of the businesses that he's attracting to town, I think you are going to start to see a younger crowd coming back to it.
But it is fairly expensive. I mean,
Yeah, the housing is a big
because
problem.
my husband and I rented here before we got married, and then when we went to buy, it was just mostly astronomical.
Oh, yeah. We're on the market right now too. We just looked at a house in Exeter. It was gone in 24 hours.
Yeah.
It's crazy.
Yeah. So it is difficult to maintain that
Yes.
younger population.
Herb has a question.
Yeah, with your work with new mothers, are you plugged into hospitals?
Yes, the New Hampshire Hospital Association and Dartmouth Hitchcock in particular is also another grantee of this funding. So they are creating all of the I am not a content expert. I'm a certified prevention specialist, and I have a lot of experience within coalitions, but I would not want to start creating content for the state that is just based off of my own knowledge, So a lot of the Dartmouth-Hitchcock, they actually have an addiction, Sarah Savage, I'm not sure her title. She's basically a community outreach, but she's a very well-known addictions doctor as well. So she leads the charge on a lot of that content development at roundtables. So,
I would just interject, I have invited the hospital, each of our meetings. Deb Vassapoli is the public relations director. She is interested, but she hasn't been able to attend as yet. And Jen McGowan is another person that Jim Moser told me to contact.
I had lunch with them yesterday.
Really?
Yeah, and,
Cleo, you get around.
Well, I get around, but they're very well, they know about it. She's
Okay.
gonna give it a try, but,
Yeah.
Debbie's got, I wouldn't wanna have Debbie's job, let me put
Right.
it that way.
Well, we need them at some
Oh, yes,
point,
but
you
they
know.
are, she did inquire.
Yeah.
I brought her up to date, is what you did.
Thank you.
Yeah.
Thank you very much.
and this conversation is also a bigger conversation. And I think I'm going to come back in January and hold a type of exercise to kind of identify exactly where you guys see actionable items to happen in Exeter.
Excellent. Yes, I look
But-
forward to that.
And one of those pieces that does need to be front of mind for everyone is types of funding opportunities, and the
Right.
hospital would be
Yep.
one of those people. So to
Yeah.
have them engaged in the coalition
Mhm.
is really imperative.
Yep.
Dover Youth to Youth is funded entirely since their federal funding has ended, which is a coalition. They are funded entirely by Wentworth Douglas, which is a rarity, but it has happened before because they saw the value in the work that that coalition was doing.
Sure.
So it's kind of best
Good to
practice.
know.
Yeah.
Mhm.
So- and that's really my song and dance. If you guys have questions, please feel free to ask them now or later.
I'm curious,
Yeah.
in your, working with the young mothers and so forth,
Yeah.
give me an example as to what you do.
So this right now has been a really intensive research. There's not a body of research right now in the nation that says this is how you should talk to mothers that are not currently using substances, but you want to reassure them. So right now our biggest problem is the fact that a mother could enter an OB/GYN office and hear a different opinion from the nurse, the doctor, and the secretary around alcohol and other substances. Some doctors say alcohol is fine.
I understand that, I want to
Yeah.
know, what do you do?
So we're holding the focus groups and compiling a lot of the literature. So right now we have a 32-page research report, and now we're getting into our creative process. So we bring the stakeholders, and one of those groups being an actual group of expecting moms, to a table, and we test messages with them. And they say, that would work with me, that wouldn't work with me, and we try and narrow down a prevention message that is applicable. And we take that message, it's really kind of a tedious process when done correctly, and we bring that to a wider group of women who are expecting, and they say, yes, this applies to me, no, I think this is a bunch of baloney, no, I'm still gonna use substance, whatever they might have as comments. And we go until we find a message that resonates with the majority of the women. And that'll probably happen in the spring. So this whole process, we receive the funding early fall. So by springtime, we'll actually have a campaign starting the creative. So doing the filming, doing the ad buys, and all of that other good stuff. So we're behind the scene. You can look at us almost as a marketing agency with an expertise in SUD and bringing a lot of partners together. SUD acronyms are very heavy in our world, as they are in many other fields, but trying to check myself. Does that make sense?
It does.
Thank you, Devin. I'm sure we'll have questions as we go along. I find it fascinating that the Speak Up campaign is exactly what I heard on NPR today from Michael Botticelli, who was in town talking about messaging, among other things. And the first thing I thought of was that I chose the name Opioid Task Force because frankly, I wanted to attract people, and I knew that subject gets people's attention. But we may want, at some point, to consider the messaging of our title of our coalition. So it's just something to think about, because I think the people in the field feel strongly that we have to start using the proper terminology, because we know this is a disease, and if it is, then we should be calling it substance abuse disorder. So that's one of our first lessons, that we can train ourselves to just be careful with our language. It takes time, you know, when you change your language, you have to do it a while until it catches on. But I think it's important, and it's simple enough that, you know, we can all address it. But we'll talk about that when we have our workshop with Devin in January. Excellent.
I think it's such a simple step.
Yes.
But like, as you said, I do want to reiterate, it's not easy to change the way, especially for folks that are talking about it all the time.
Right.
The word addict recently left my vocabulary.
Great.
Because you have to continually try and work on yourself too.
It's like learning a new language, right? How many times do you have to learn that vocabulary over and over again before it's second nature?
And I will say, Seacoast Media Group, especially Hampton Union, Exeter Times, Exeter Newsletter, they are actually probably the best in the state.
Wow.
I
Good
was
for them.
just interviewed by one of their reporters, Max Sullivan, and he said, oh no, our news editor sends this as a memo like every other month.
Okay.
Which is really impressive for a media organization.
Yes,
So.
it is. Good to know.
I think substance abuse is so much more comprehensive. too.
Exactly.
A lot of what's being talked about is alcoholism and, you know, a variety of different abuses of drugs of various kinds, not just opioids. So I think
You're right.
to broaden it will hit a lot more people.
Sure. Yep. Agreed. Excellent. Yes, I think so.
All right. Like I said, I'm from the Seacoast Public Health Network, and I am the Substance Misuse Prevention Coordinator. I've been in this role since about the end of July, so fairly new still. But my job is to gather intelligence from community members and see what's really going on in the region, to look at reports like the monthly drug monitoring initiative and kind of follow the trends of that, to follow the yearly youth risk behavior survey that comes out and see where our youth are, falling and what they're saying and what's going on, and then to create an action plan from that, to really say, what are the priority areas, what do we really need to work on? And one of the things I realized in the Seacoast is that our youth, it's actually 32% of our high school youth report that they have very easy access to prescription drugs in their home, which was concerning to me because 80% of people using heroin started with a prescription drug. So if we think about, we have 30% of our Seacoast kiddos saying that it's right there in their house and they can take it, and 80% of them, that's not good. So one of the first things I started was an initiative called the Seacoast RX Safety Initiative, and basically passing out these rat cards and just with tips for parents. I don't really like scare tactics of saying like, this many kids did this. I like to be solution focused, so it really just has like a simple little acronym of monitoring and educating, disposing of your medications. Exeter Police does have a take-back box all year round, so in this town it's super easy to get rid of them. And importantly, really like securing medications. I don't think a lot of family members understand how, it's not about trusting your kid, it's there, and if they have risk factors, if they're having a bad day and they've heard from a friend at school that taking a Xanax will make them feel better, and they see that, it's not their job to rationalize that.
Right.
And just having it out of reach and out of sight is something that's so important. So that's kind of one of the examples of something that I'll do to see, study the data, listen to community members, somebody like Jim Moyer and his story, and then take that and really put it into something that we can put out in the community and measure if it's working, is it reaching people, is it making a difference, because we do want to see those numbers go down. Last year in Rockingham County, which has many of the Seacoast towns, we had 488 Narcan administrations and 90 overdose deaths. So far this year, as of October, we have had 71 deaths. So it's still considerably high, and that number jumped from August. It was only 1, and it jumped 20 deaths from August to October, just in our Rockingham County. I think this town is really unique, and I grew up in Stratham. I went to Exeter High School. There are clusters of people that really turn a blind eye to this, and that's been a struggle. There's communities where it's right out there in your face, and so they just have been forced to deal with it, and I don't think, I don't know, it humbles me to see that a group of people like this at the table, because I've kind of been waiting to see, because there's always been said, like, there's two Exeters, there's two sides to this town, and it really is true. There's extreme wealth and there's extreme poverty. So, we have to be cognizant of what's happening right here in this town, in the Seacoast, and figure out what's happening that we need to focus our attention on.
Absolutely. I'm sorry that you missed Cleo's presentation last time, because
She's very well aware.
Yeah.
So he gave us, some of those stats about, 20 families sleeping in their cars, and it was very sobering.
And one of the things that my organization partnered with Exeter Hospital to start a pilot program called the KEY program, and actually the Y is part of it as well, to simply, the KEY program. It's giving any child who's elementary, middle school, high school age, who's on the free and reduced lunch plan. It gives them, if their parents enroll them, the letters went out the first of the year, in the beginning of the school year, gives them access to programming, after school programming. So the rec department, things that cost money that those kiddos might not normally have access to. Because we know that a protective factor for kids is having some kind of community involvement, exercise, staying busy. And a lot of Exeter youth were being kind of left out of that, because it costs a lot of money, especially, rec department stuff. So that has been incredible. We've had a ton of kids sign up. The Y is offering discounted memberships. There was a whole family of kids that signed up. So that's another thing that we can use. Just simple things like that, where we do have a lot of resources in this town, a lot of different community members and businesses. We have a hospital, we have a great police department, and so we have those things in place to really build capacity to address this. So I think that's really, there's something to be said about that. And what I think could be a great start here is giving people a venue to ask for help, and maybe involving the police and saying, if somebody's seeking help, could they go to the police station and come in and
Modified safe station?
Yeah. So right now, the Seacoast towns that are doing that are Portsmouth, Seabrook, and Newmarket. And it has worked really well. Officer Keaveney from Portsmouth. I don't know if you guys know him.
Keaveney?
Yeah, Dave Keaveney.
No.
He kind of started the Community Access to Recovery program within Portsmouth Police Department. He was supposed to come tonight, but
Is it kind of those towns for Portsmouth or no? Because I know York Hospital is connected to the Portsmouth part. Like, it's a couple of seacoast towns. So I wonder if that's just true.
Yep. So it's the same model. So if somebody goes into Portsmouth Police Station and says, I'm looking for help, they kind of just assess what's going on, make sure, that they don't need immediate medical attention. Originally, they were taking them right to Portsmouth Hospital, and a recovery coach from Safe Harbor was meeting them there. But unless, and Ryan can probably answer this, but generally they're just taking them right to Safe Harbor right now, right?
Yeah, I mean, the ones that I've caught are usually transported by family members. Just in my experience, and there's been other situations where the police will transport them, but yeah, they're just coming to Safe Harbor looking for help. And as you know, and that conduit's been Newmarket PD, Portsmouth PD, and Seabrook.
Yeah. And with Newmarket, it's been a huge success. They have a similar task force here, and a young woman who had gone into the police station and gotten linked up with, I think, Ryan at Safe Harbor, went to a 28-day treatment program. And the day she got out, she called Kyle Chief True and said, thank you so much, you saved my life. And that's rare,
Right.
And depending on what you all think, if there's a need there for something here, for something like that, it is an option. Other towns have seen really good success, and they've seen a lot of success in kind of breaking that wall down between the community and the police, and just bringing everyone kind of together.
How did those departments compare to what Gloucester Police Department's doing in this?
It was modeled after that. The thing with New Hampshire is we don't have the capacity to guarantee somebody treatment, so they do that. But we call it modified kind of safe station because you're going to get something. You're going to get a resource. You're going to get linked into the right, recovery coach or certified recovery support worker, and get resources. But guaranteed treatment, because there's all different types of treatment as well. We're trying to stress getting somebody the right level of care. So starting with, a screening and an assessment, and getting a clinically appropriate recommendation for treatment. So that's just that's why starting with getting them linked into somebody like Ryan is, so.
Well, that's all very interesting and good information, and something for us when we do our action planning. I think we'll just list a whole bunch of possibilities, and we need the stakeholders in town to tell us what will work for our town, right? You have to have all the supports in place if you're going to offer something to the community.
Yeah. And it can even be as simple as starting with, if and when you respond to a substance-related call or an overdose, carrying the little card that have that have the New Hampshire statewide addiction crisis line on them, and just having something there with them to say, when you're ready for help, please reach out. I have those as well.
Yeah, the packet that you gave me has so much information in it, and I think everyone here would benefit. Excellent.
So, and the reason I wanted Ryan to be here tonight, not only because he's a good friend and I adore him and he lives in Exeter, but because he has a really positive message of hope, and it directly relates to the Exeter Police Department and shows their positive involvement in his story of
Awesome.
recovery.
We're eager to hear it.
Yes.
Sweet. Thank you, Olivia. Really glad to be here. Pretty much told the story, but so as I said, I live in Exeter with my folks. Lived here for quite a while. I had quite a long career using drugs and alcohol, about 10 years, so I guess I'll just keep it pretty relevant. I won't get all ideological and political or anything. So yeah, you know, I struggled for a long time living in Exeter. Bought and sold drugs in many of the communities around here. Had plenty of interactions with folks such as yourselves, first responders. I've been revived by Narcan multiple times, and it's just a really bad scenario. You know, I came from a pretty good family, but I had some adverse childhood experiences, and my coping skills involved drugs and alcohol, and they served their purpose for a long time, but it got to a point when it wasn't really working, and so I found myself being revived by Narcan again and brought to Exeter Hospital, where I was released in acute withdrawal. And then I went on my merry way and did what I know best, with really not a lot of knowledge or anything else, is to go and use more drugs. And you know, at this point, there was just I was kind of giving up. But someone called in my driving on my way from Northampton to Exeter, and there was an Exeter police officer, two of them actually, waiting in my parents' neighborhood, and Exeter PD knew who I was. They knew what I was doing, and so someone called in my plates and they said, "Oh, he's going right here in Exeter." And so they were waiting for me, and pulled into my parents' house, and you know, I was pretty cooperative at this point. I was usually trying to stash things, and I had just overdosed 8 hours prior in Exeter Hospital, and I was just relatively cooperative, and this is unlike any experience I've ever had with first responders. They were generally really kind and compassionate, and were just really encouraging, and were like, yeah, like, what are you doing? You know, like, you're clearly from a fairly decent family, like, you have a lot going for you. So they arrested me. I had a couple felony drugs, a good amount of syringes and paraphernalia, and They took me in and they talked to me like an adult, like a human being, and it was really a profound experience despite being under the influence, and I was surprisingly released on PR bail, but that wasn't before they said things like, you know, there is help out there, maybe, you know, you're obviously, I probably looked like I was going to die, and actually my police reports say I was visibly dehydrated. Injection drug use isn't the healthiest behavior in the world. So they, you know, just kind of encouraged me, and I went on my way, and, you know, that was the start of my journey in recovery. Today, I was fortunate enough to be given alternative sentencing through the Rockingham County Adult Felony Diversions Program, and so after completing a year-long program with clean drug screens, community service, a whole bunch of money to the courts, and all that wonderful stuff, I completed that program, and I'm today not a felon. And you know, that all started with a really positive interaction with police officers in Exeter, and that wasn't really in the forefront of my mind until I started doing these compassion fatigue trainings for Derry EMS and Salem EMS, and talking about my interaction with first responders. And I kept going back to Exeter PD. It was that night, and I remember it was in a week from today, it'll be 3 years ago, so it was December 21st, 2014, and it was just really, really profound how a few kind words and being treated like a human being and like pushed in a positive direction got me to get myself into treatment. I spent Christmas and New Year's in a 28-day program. I got out and started that adult felony diversions program, and ultimately saved my life.
Praise God.
It just goes to show that you know, it's I can't really elaborate on that. And today I'm a certified recovery support worker. I help folks go through the process I've been through. I use all my experiences, no matter how negative, to help others through similar situations. And it's really profound, like what I get to do while I'm at Safe Harbor in Portsmouth or Seabrook, or while I'm on the crisis line. It's really cool, and I'm a really big proponent of helping individuals who are struggling with substance use disorder feeling connected and engaged with their community. And if around every corner they feel like they're just going to be put into a cage, already feeling isolated, it doesn't really help people seek help. But like what we've seen in Newmarket and Portsmouth, Gloucester, Manchester, Nashua, these kind of safe stations that are like adapted safe station models, is that when you open doors to people, they will come for help. It's really really profound. I spent about 8 months working for Manchester Safe Station program before I was in my current position, and it's really profound the role that first responders can play in saving lives, and not just administering naloxone or like interrupting dangerous situations, but being a conduit to recovery. And that was my experience and the experience of countless people that I know and have helped. So yeah, that's my story. Thanks.
That's a profound testimony, and you articulated beautifully, and it is the best good news that there is out there, that after multiple tries, it just took, it worked. And I have heard from some first responders that it's discouraging to them that they have to revive the same people, but relapse is part of recovery. So again, that's part of our education, to just learn that it can be a long process. We all wish it were not, but in fact, it often is. And to know that you've come through this and that you're doing this work is just so encouraging to all of us. Thank you, Ryan.
I've got to tell you that Ryan works over at St. Vincent's on Mondays, and he's on the phone, so I have no idea who his clients are. but he keeps his door open, and so we hear what he says. And I got to tell you, at first I looked at him and said, and now I am very impressed with what this guy does. Well, I shouldn't be ear-dropping like I do, but I am overwhelmed. You're just, I just wish there was some way that you would stay with us. His program is closing up, and it's breaking my heart.
Which part of his program?
RAPS.
Oh, yes. Yeah.
So, but he's a good kid.
So why is that happening? And
Yes.
is that something that so how much money is needed in order for that to?
Way above my fifth grade.
I
can't really speak to it.
But I mean, just to keep on doing what you're doing there, maybe it's always good to know, because sometimes we don't realize, we always think we're so poor, there's a lot of money all over the place, and maybe we just don't understand sometimes, what we need to do and how we can respond.
Devin, please.
I think a response to that would be to bring New Futures in. New Futures is a statewide advocacy organization. I share an office area with them. They're a very, very sophisticated team that advocate for things like what you're saying, and they'll teach you how to do that. So if you hear that this contract is going away, you can respond appropriately. But I can also speak for the state contracting piece a little bit. I'm pretty heavily involved in a lot of the legislation pieces, and right now things are just kind of on hold. So things might change probably halfway through at the end of this fiscal year, which is June 30 for the state. But essentially we have what goes into the opioid crisis that are federal dollars, but are used for very specific pieces, but they just see that as X number of dollars going into the opioid crisis. So some of these more flexible programs like RAPS are getting cut just because those flexible dollars are going towards other things, like plows. Plows.
I want to introduce Skip Berrien. He's a state legislator from Exeter. Came in just a little bit late, but he was here at our prior meeting. Skip.
Yeah, there is a bill, unfortunately I don't have the number, but I can get it to you. It's a House bill being sponsored by Sharon Nordgren. As you probably, as you may know, a good part of the, it's a small part of the profits from the sale of alcohol in the state goes into a fund for treatment and prevention of substance misuse. And the original intent was that 5% of those profits were to be used. We in the last session and in this last budget, we allocated 3.4, right, 3.4%. It's never been fully funded at all. But this bill is intended to take it back up to the 5%, to get it up to the 5%. And there also is a provision that some of that money could be diverted to another purpose if need be. And so this bill is to avoid that diversion of funds. So yeah, I was told yesterday that the funds are fully accounted for, and I'm sorry that Ryan's program is being nixed at this point, but it doesn't look like there's any funds that from that source that could be immediately diverted there to resurrect your program. So yeah, it's a sad situation. We should be using more of those profits from liquor sales for this purpose.
Can I ask you a question?
Sure.
Are you aware of the Senate bill that was just introduced to take 10% of the rainy day fund for opioid?
No, I hadn't seen that. No, we're still, the bills are still emerging for us at this point. I keep track of more what goes on the House side. But I am a leader of the Children's Caucus, and we heard from New Futures yesterday, and we have endorsed this bill to restore funding for treatment and prevention. So.
Thank you, Skip.
Thank you very much.
Yeah.
We are funded part, very small, little bit, but from the Health Fund, so thank you.
So we know for sure that RAPS is done at the end of the year?
No.
No. What do we think?
What happened was, just a very quick synopsis, is the New Hampshire statewide addiction crisis line started 2 years ago, like this time of year, maybe January or something, less than 2 years ago.
So 2016.
Yeah, 2015.
2016. The crisis line.
Yeah, January or February 2016, right?
Yeah. A little later. Sorry.
Yes.
Yeah.
So it'll be 2 years.
Yeah.
And then, like 6 months later, there was a sole source contract awarded to Granite Pathways to introduce the RAPS program, Regional Access Point Services, and that was meant to have a group of individuals. I was part of that group at the time, to filter the calls from the statewide crisis line from 11 out of the 13 public health regions. So every region except for Manchester and the Monadnock region would be transferred from the statewide crisis line to a RAPS person to basically get the person screened, get them an evaluation, and link them to treatment resources. Then the RFP that came out this spring was the logical decision to merge all of it together to make it, one program of, you call the statewide crisis line, this is what happens, it's just one thing. And that RFP was canceled.
Oh.
So everybody's kind of in limbo right now, but Ryan's not going anywhere for the time being.
Yeah, I mean, I'm ultimately doing the same thing, just as an employee of Safe Harbor Recovery Center, which is also part of Granite Pathways. So like she said, I'm not going anywhere. It's just going to look a little different in the state. So I can't really speak to any specifics.
Sure.
But
So in effect, you're on loan from them to Cleo's organization right now?
yeah, so they had offered office space for a rap specialist to come in because they have Sister Maria Joseph there, who's in LADAC and MSW, and she's doing evaluations and doing like one-on-one counseling there, and so it's going to be kind of a cool dynamic.
Team, yeah.
And funding's going a different way. I'm gonna
But
be
is
in a
that
different
part
role.
going to continue, what you're doing there, or is that going to end at St. Vincent de Paul?
Well, he is, Sister Mary Joseph is still with us.
Okay, but
Yeah.
you won't be there.
No.
Yeah, I mean, if I would be there over the phone, I mean, I'm just a phone call away
Right.
doing what I do, but
But what he does, he's very humble.
Yeah.
What he does is, and that's what gets me, is that when somebody needs help, they don't just need a phone number and
Right.
an address.
Sure.
And until tonight, I really didn't realize you opened up my eyes again tonight. But when they speak to him and when I hear him, he is, and I don't think he knows it, but he's really more of a counselor, but he's not a counselor. It's like calling your brother and saying, hey, Jack, I got a problem. And that's what he does, better than I've seen anyone else. And so, they've got to voice someone who understands.
Absolutely.
You know?
Right.
It's just like on our prison reentry program, our best counselors are ex-cons.
Sure.
They know.
Yes, they do.
You know, they make me look like a fool, they just, you know what I'm saying. But they know, and he's in the same way. And now I understand so much better tonight after hearing him, as to why that you were able to make that contact. And that's what pisses me off, is that he's,
And it's a very
you don't
limited
have
service.
enough bodies like this. That's the problem. You've got people who are what I call first-row bureaucrats. They just gurgle out something that somebody says, okay, here it is, this is what you're gonna tell them. He doesn't do that.
Right.
And
Well,
so that
we
pisses
do
me
have
off.
3 pastors and 1 clinician at the table as well, and they do this work as well. The problem is getting the people to them, That's one of the reasons why we want the clergy involved, because they head congregations of people, and their people have the same problems as every other cohort of people have. And as our clergy get informed and more comfortable with the subject and get information about the resources and how to refer people, where to refer people, the tentacles into the community will just grow. So it's very exciting to know that we have pastoral counselors on our team, because they both have training that's useful and they have access to the public. So we're going to learn a lot, and we're going to do a lot of good.
I'll get 2 more. One is, we have, through the hospital, we have a transportation budget. And so if you do encounter anyone who does need a ride to wherever, and so send them over to us.
That's the biggest barrier in this whole state.
Yeah, and so we now have funding to do that.
That's awesome.
Through
that's
the
really
hospital.
good to know, because that's a huge barrier.
Oh, yeah, and so just,
Yeah, it's like amazing.
and Debbie's always asking me about it, and so, but you gotta tell me a few stories, because that's how I feed her. Okay? And the other one is that, with the Y, I had a meeting today with the new director, and they want to do more with the kids. And he said something that I hadn't heard in a long time, and he says, I want to know the community. I want to know where they are. So I was thinking that maybe you and I will pick them up and we're going to give them a ride around town.
And we want them on our committee, because
Yeah, well,
I just found out this week that there's a new director.
Yeah, but I mean, it's the first time he says, I want to know where they live. I want to know where they are. And I almost fell out of my chair.
What's his name, Cleo?
I have to wear a name tag so I know who I
Okay,
am.
all right. Well,
Sorry.
we can ask the folks out at the front desk. I'm pretty sure they'll know.
Yeah, no, but I said, we can do that. I was thinking about you, and you and I we'll give him a right, we'll show him where they live, if he wants to do that. But that would be the first impetus, and then we can work from there, and then with you guys, and then let's go at it. If they're willing to do this, between the Parks and Rec and the Y, we can, to me, get them going first. We're gonna give them a high. I always think the Rocky Mountain High, well, give them a high here. This is where it starts. And
Sure.
then they won't think about anything
Yeah.
else.
The Y folks are having a Christmas party tonight, so they couldn't be with us, but they certainly have those youth leadership programs, and they're very active and eager to play a part in whatever we decide to do, as
Yeah.
well as what they're already doing.
And the other thing which they do is, I know they, as you said, they have a discounted program,
Yeah.
but if they come through St. Vincent's, that goes away. So it's 100% free.
Oh, really? Okay. So some of those families might be.
Oh, yeah, absolutely. We have to, as I said last week, we have to look at the whole picture.
No.
And so once you get on board on that, and so that's, that works.
Yeah.
Steve.
So, it was nice what you said about pastoral counselors, but I feel like I know nothing, in
Well,
terms
that's
of-
why you're here,
Yeah,
so that
but-
you can
So
learn.
that's good, but, I think that, I'm just thinking here about funding mechanisms and how often we think about government in terms of the way to fund. Of course, it's, that can be, it gives and it takes away, and it could be very unstable in some ways to have that as your mechanism. But I'm thinking about St. Michael's Church. It's the largest church in Exeter.
Yeah.
So many people have connections to St. Michael's Church. Bethany is a large church. Next Level Church has now, and they're meeting at the middle school in Stratham. They are a very large, growing church.
Where are they? In Stratham?
Yeah, their mothership is up in Somersworth, and they are one of
Okay.
these multi-site things that just
Okay.
come up over the last 10 years. Now, there's got to be people in these congregations that have suffered from, substance use disorder.
Right,
Right,
yes.
Okay, all right, and it seems to me people are the answer.
Right.
So part of what makes, Ryan so powerful is that you've been through this, got helped by Exeter Police, led to other people, led to some real help. What if there were a way to fund, so you get a referral, it sounds like a lot of things come in through that referral number. I wrote that down on my phone, 844-711-4357. So if I have anybody, I'd want them to call there,
Crisis. Yeah.
So that number then is gonna hopefully lead quickly to a person. Okay. What if there were a way to fund people that wanted to get serious about getting out of the problem that they're in? So you think about, it's just like you're supporting a child overseas, let's say, when you actually have a person connected to it. You say, okay, our various churches, we want to help to support person by person. I'm just throwing that out.
Sure,
I probably don't know what I'm talking about.
No,
you know?
I
So I'll
can
just
tell
say
you,
that.
I
But
can
that-
tell you that Newburyport, the town of Newburyport, a family had a friend of their son's who needed treatment, couldn't afford treatment, and they started the Pelican Fund. And they have sent a small number, but a dozen individuals into treatment because of the fundraising that they do in the community. And so, there's a lot of ways to combat this. That's one of them. Yes, Devin?
That kind of exists a little bit, not through the churches though. Have you guys heard of Chucky's Fight?
Yes.
So Chucky's Fight has single-handedly paid for people to get on planes to available treatment. In fact, we were just meeting with him about a month ago because he kind of took over like his own little addiction crisis line. So he was getting so inundated with phone calls. But all of the donations for his dips in the ocean and other events that happen, he has funded, I think it was over $200,000 worth of treatment last year.
Yeah.
And that's almost strictly Seacoast folks.
Yeah.
So that would be someone to tap into if you, with the faith community, kind of because he's already an existing figure that's really kind of known New England-wide.
Sure. When we get really established and can have perhaps an action plan and maybe subgroups working on parts of the action plan, we could present, you all as pastors meet in a coalition, right, on the seacoast or by denomination or in some ways?
It hasn't for some.
Not really.
Is that right?
Yeah. There's a United Church of Christ.
Right, so you do it by entities.
But, well, yes, but we've tried several times in Exeter to get something going, and just scheduling is hard, which is not to say that it
Sure.
couldn't happen.
Right.
But it's been a while since that's been active.
Okay, because I was just thinking that, we could make a presentation when we're able to the churches or to the clergy, and then see if you all have missions budgets. Pastor Lillian talked about it last time, how her church wanted to give some money to the fight and didn't know where to go with it. Couldn't really zero in on something. But the coalition of churches together would be pretty powerful, and that's kind of one of my goals. So there's the nonprofit sector, right? Trying to tap into whatever might be already established that has funding. And then there's the for-profit sector. We have some pretty successful businesses in town, and I think when we get to that point and we know that it's treatment and what kind of treatment and where and all the particulars that you would need to put together an MOU or something that you could present to a business and say,
What's an MOU?
Memorandum of Understanding.
Okay.
Yeah, a proposal, yeah, put together something. So like I say, we might have a subcommittee that could work on that, getting together treatment possibilities. Olivia has this wonderful handout. Do you have enough for?
I think I should,
Yeah.
and if I don't, I can email them,
Yeah. It's got, almost all the resources on the seacoast, so that in
And
itself.
I'm curious to know from the officers here, kind of what, when you encounter somebody and do you find that people in this town know where to go, what resources? If they're looking for help, do they feel like they have no idea what's out there, or is there a lack of awareness?
I think it's a kind of across the board, whether they've experienced it already and maybe have started down that road and relapsed, for lack of a better term, or they haven't reached a point where they want help yet. So I think we kind of probably have all of it, so to speak.
And Jamie, I'm interested.
This is certainly something that we need, that in my introduction last month was this needed to happen here, because I saw what Chief True was doing in Newmarket. I attended the first couple meetings that he had, and knew that we needed to bring that here to try to make it more obvious that there are people, there are agencies that want to help here.
Yeah.
We just needed to make that happen. So, as I said, Cleo was a big part of that with his program now. I think all of it.
And that's because of him.
So, I think it's.
Well, he keeps coming out with these
a work in
handcuffs and says,
progress.
I think it's a work in progress.
Yeah.
I think it's there. It's just a matter of making it more blatant and more obvious that it is there. So, and getting the funding.
Yeah.
And the resources.
Right.
Those that are willing to help.
Jamie, I'm interested to know what you think the school, where things stand with the programs that you've had at the school.
So we kind of more reactionary. We kind of deal with the kids who either, arrive to school at the influence or have drugs or whatever in their possession at school, and kind of we just started a partnership with the high school with Seacoast Youth Services to run our kind of our buyback program is what that's called, and so it's really kind of linking those kids up with effective treatment there. We do have 2 student assistance counselors, one at the high school, one at the middle school, that are both licensed LADACs, and it's not as if they don't strictly function in that capacity, just so that any student who's seen associated with that kid is kind of targeted as somebody who has that type of issues. And so they do try to kind of branch out and do a lot of different things, but they certainly have that expertise and are aware of all the resources that are available.
Now, Jim brought his film, right? Jim Moyer.
Correct. Yep. And so we had Jim Moyer presented to the entire school last March, I think it was.
And did you have discussion groups after that?
Yep. Mm-hmm. So we did 4 kind of consecutive class assemblies, so to speak, and then we have an advisory program that we kind of followed up with a conversation. It was very good feedback that we got. Kids felt like kids took it seriously, and I think got a lot out of it. Certainly,
that's got to be powerful.
Absolutely.
I think that's the kind of education that kids pay attention to.
Yeah, and it was powerful because in that film, I went to school with Adam, and you see right in that film him in the Blue Hawk helmet running down the field. So to play it at that school where he went was very powerful.
So we'll continue to do that with those freshmen. Cleo's coming to visit with all of our counselors tomorrow, K-12, so to talk about his program. So I think, like I said last meeting, my biggest thing is kind of allowing access to those resources for all the kids that we can become aware of, that we
And do you still run the Life of an Athlete program through athletics?
I don't know where we are with that. I know that kind of spun up in different capacities.
Like the Blue Hawk? Is it? I think
Mm-hmm. And that's just one church. There are.
Is that AA only or NA as well, or?
Most of them are AA.
Okay.
But some folks go to AA meetings who
are using,
And it would be good to have more voices of folks in recovery around.
Sure.
Because I think we really have to privilege those voices.
Absolutely.
And so, AA and NA as fellowships don't endorse or get involved, but individuals will.
Sure.
So that's one. The other is I know this is the opioid task force, but really being aware that in many ways alcohol has hurt this community in so many ways.
Yep.
There have been a number of deaths of young people that are alcohol related.
Sure.
And as a pastor, I'm much more likely to see someone who's wrestling with alcoholism and trying to get it.
Well, that's the true gateway drug, is alcohol. They talk
I mean,
about
it's different
marijuana.
for everyone,
Yeah.
And so I just, but the struggle of substance use disorder comes in many forms, and so in order to have a broad net, really thinking about, all the different kinds of addiction people can have.
Absolutely.
And it's the same stigma we're trying to break.
That's right. No, I appreciate that very much. And as I said earlier, I'm not wedded to any particular name. Devin is talking about messaging. We have to decide how we want to message ourselves as a coalition. And that's, something that I'd like you all to be thinking about. Ipswich calls their coalition Ipswich Aware. They just clearly wanted any subject that might come up in the community that would be an issue. They would be a go-to place where stakeholders in the community would be gathering, and they would discuss whatever was going on in the town that was important and touches all the different entities. So we can decide what to call ourselves, and I have no predilection toward one or another. Cleo.
Once you start getting a dollar that goes across your table, you're going into a whole new dimension. And because I'm a CEO, I know the legal aspects and how to do them. And there's a lot of them. I will introduce you to a Form 990 that's going to blow your socks off. But that's got to be done, because anyone who does give you a check, and then all of a sudden you open up a new door to the state of New Hampshire and through an organization called the Internal Revenue Service. And so I can help on that. And the other thing which happens is once you start putting up the name, you can better make sure that it's registered.
Yes.
And so we've got to go through that registration process.
Sure.
You also got to go through an incorporation for nonprofits.
Well, I wonder, since we already have nonprofits in town.
Well, then you'd have to hook your wagon onto them.
Which is
But why
much
not?
easier.
That's what
Yes.
Newmarket did.
Yeah,
Newmarket
did they?
ASAP just hooked on to the Newmarket Community Church.
Okay.
But you got to, well,
I
I know something about that. And so the IRS is not too thrilled when they hook up to a nonprofit such as your church. Not the right way to go. And it's not, so it should not be our way. So for instance, we are part of St. Michael's, but we are totally independent. And we have our own 501, we're totally independent, completely.
501c3 organization.
What's that?
Should be a 501.
Well, and it is, but I mean, but you can go, the IRS, you've got to have an I number and so forth. I can help with all of those things, and she's absolutely right, and I don't like the way, because I've seen that happen. I've seen some organizations that hook their wagon onto a church, and all of a sudden, there's this gentleman who knocks at the door and says, guess where I'm from? And they pay a heavy penalty. And so, unless it's done properly, so it's easier to be independent.
Yeah, that was more because they were, it was a church. They didn't like just
Because
start
it is of the church
independently,
itself.
it was of
Right.
the church.
So now it's more of a ministry than it is,
Yes.
than a real coalition.
And I can help with that conversation. It might be better offline than if it's
Sure,
a bigger
sure.
group, because
Yep,
there's definitely
absolutely.
pros and cons of being an individual, for a coalition piece, until you start applying for like federal funding, etc. But sometimes.
Not just federal funding, applying, as soon as you get a check.
Oh, I know that, I'm saying, but to be an independent nonprofit is a lot of work, and
Well,
there's
it's a
almost
501,
no
but we don't have to go all the way to the 501. There are other ways of doing it.
It sounds like Devin has some good experience in this
Yeah,
area.
definitely with my old job was just to build coalition capacity, and one of the biggest pieces is it's almost all volunteer staff, so you don't want to have too much overhead work. So to latch on, it doesn't have to be a church, but maybe to like make a map or an assessment of other 501c3s in the town might be helpful, at least in the immediate term would be helpful.
Well, we have opened up a whole lot of possibilities, and I don't want us to get too far ahead of ourselves, because again, we're just getting started, right? And we want to determine what the scope of our interaction should be. And we can certainly meet within our own entities, you know, the organizations that you work for. I'll be talking to Olivia and Devin both and gaining more information from them. And we'll start out slowly, you know. I think once we have confidence in what our coalition is for, what we're about, then we can advertise ourselves to our community that we exist and take stock of what our community wants from such a coalition. You know, we can interact with other sectors of the community. Maybe we want a mailing, maybe we want a public meeting. I mean, there are a couple of ways to go that don't go so far down the road as the 501c3. But, you know, we'll see what the Lord has for us. But I aim to go somewhat methodically and slowly. And I do want to respect your time, because it is the busiest time of year, and I appreciate so very much everyone coming out tonight. And I will be in touch about it. Skip, did you have something you wanted to add?
I just wanted to I put on my pediatric hat.
Yes, please.
And highlight something that Ryan said and just passed over. And that was, he mentioned the adverse childhood experience.
Yes.
And which we know from the studies that have been done on adverse childhood events that kids who go through that are more likely to run into these kinds of problems. And also that the families, the children in families that are affected by this type of disorder are experiencing adverse childhood effects.
Sure.
So we need to really look at breaking the cycle, and so I hope that at some point we can be really looking at some of these prevention efforts, some of which are already happening at the school. 2 years ago, there, coming out of a legislative task force, there was legislation that said the schools at every level, at every grade, was to have prevention programming. And I'm anxious to hear more about what's happening here in Exeter in that regard.
Thank you, that's all important. I do want to say, too, that I reached out to the Seacoast School of Technology. They are interested but couldn't come. I also reached out to Esther Bell, who's the Assistant Superintendent. Esbell?
Esbell, yeah.
Because someone gave me her name and said that she would be interested, and she is. She couldn't come. And then lastly, the Greater Exeter Charter School. It's got a lot of letters. Peter Stackhouse, I reached out to him.
GBEX.
Thank you.
GBEX. Great
GBEX.
Bay E-Learning Charter School.
Okay, it's a long one. But I am aware there are other schools in the community, and we want them all to know that we want to share information with them. So I'll be sending an email after the holidays about our next meeting later in the month of January, and I welcome your feedback as a result of this meeting. Any thoughts that you have, please share them. Pastor Emily, did you have a thought?
No, that was all I had.
All right, thank you. So thanks, folks, and Merry Christmas.
Thank you.